Good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. Bill Kearney and me in the studio. And, well, it's the big 4th of July weekend coming up. Some people get 4 days off this weekend. I don't. But
I don't either. I get 1 day, 2 days, I guess.
I get,
one day.
I get Saturday and Sunday and then the 4th off. That's it.
I work Monday. I have inventory on Monday. And I wanted to congratulate you. You got my name right this time, first time in 2 weeks.
You know, it's funny because in the beginning of my intro, when I was saying the call letters, I thought in my head, make sure that we get the names right.
Well, whatever, it transferred over to the mouth, and it came right out just fine. If you guys haven't been listening the last couple of weeks, Paul says,
I've had some identity
I'm Bill
crisis
Kearney, this
issues.
is Paul Thomas. So
I don't know who I am anymore.
It must be dementia. I don't know. A little early for that, but
the Chantix I'm on is what it is.
Well, I'm real happy for that.
Yeah.
Paul's been battling smoking for years and years and tried to quit several times, and luckily his insurance paid for this drug, and it's been 5 days, has it?
Well, so the way that it works is they start you out on a low dose for like the first 4 days. You take it once a day. And you're supposed to smoke for the first 7 days while you're on it. And then the remainder of the 7 days, the last 3 days, you take one in the morning and one at night. And then they bump you up to a higher dose after 7 days and you're supposed to quit. And I guess that the way that the drug works, from what I read, and I think I talked to you a little bit about it, or no, I talked to the doctor about it, is that when you smoke, you open these nicotine receptors in your body, and when you're done smoking, they like close immediately, and it causes your body to want to have nicotine again to reopen them. And what Chantix does is that it opens those receptors, and then instead of closing quickly, they close really slowly over a long period of time. And then you take your second dose at night, and they open it up again, and so your receptors are open, and they think they're getting, I guess, nicotine. Kind of how the patch works as well. And it's been really crazy. I mean, I haven't had a desire to smoke, and I can eat, and usually eating and drinking were the two things that would trigger it. Incidentally, I haven't really had a desire to drink so much either. So I haven't been drinking, I haven't been smoking, and also, I don't know that this is recommended, but it's been working for me. I haven't been taking the one at night. I've just been taking the one during the day and haven't had a need to take the one at night. So I'm just taking that one in the morning when I take my medicine, and it lasts me the whole day. So I'm hopeful with it. I'm getting good support at home with it. My wife's ecstatic, and my son's ecstatic. They've been, my son said to me last month or whatever it was, all he wanted for his birthday was for me to quit smoking.
Wow.
So
that's a big impetus to.
Yeah, that's a big one right there. So let's fingers crossed and keep it going, and then it's a 30-day supply.
Then you step up to.
No, that's it. That's all I got was one 30-day supply, and then you're supposed to get a new one. Is that what happens? And I don't think the insurance covers that. The second supply. I think they may only
should.
Maybe it will.
Well, the drug we're talking about to our listeners is Chantix, and it is very pricey, $350 our cost. And Paul and I have talked about this drug for a long time, and we just assumed that insurance wouldn't pay for it because it didn't used to. So I would think they would follow through because it's not any cheaper for the next 30 days.
When I called your pharmacy and talked to one of the gals there, they said it's a one-time coverage. They cover it for the first period of time, and then I'm responsible after that. So I hope maybe in 30 days I kick it completely, and then I'm not having to have any cost beyond that, but I guess if I need it, I will. But so far, so good. So
well, I'll double check that also. Well, yeah, it's the 4th of July weekend. This will be a good trial for you. With luckily, you're like me and you don't have a lot of time off. But when you do have time off, and you get around people and you're having a good time,
you're right about that. Yeah.
It's a great temptation. So rather than talk about sun and those kind of things like I've done the last 2 weeks, we have a lot of things to cover, and I had my conference call this morning at 4:30 in the morning, Dana said, "What were you doing?" I said, "I have so much information. I'm trying to go over the information so I know what I'm talking about because there's so many different things going on." And they all involve the same thing, the cost of drugs, what's keeping your prices up. Consumers Report just had a major report on this yesterday, and I went through it all. And some of the things that are causing these are one of the examples I'm going to give you is a specific example about a guy that went in to get his prescription, and they gave him some samples, and the doctor says this will, and he had an injured shoulder, and he was going through some inflammatory things, and the doctor said these will hold you over until your prescription comes in the mail. And he was kind of puzzled because the doctor didn't say anything. This was his assistant, and didn't say anything about giving him drugs. So she says, "Don't worry, it won't cost you any more than $10. So he was glad whatever was coming wouldn't break his budget, but he didn't understand why he needed the drugs in the first place, and he wasn't picking them up at his local pharmacy. He said, "At first I just shrugged it off on my first visit to the orthopedic specialist, and he had been examining his arm and bending it and rotating it behind his back, and he said the pain made me squirm, and he promptly diagnosed me with a frozen shoulder and a debilitating inflammation of the shoulder capsule." My experience with that when my shoulder was frozen was my orthopedic surgeon just broke it in the office, broke it free while I chewed on a towel. And
ouch!
It was over quickly. I didn't need any inflammation. But back to the drugs, he said one thing that he learned is almost nothing in medicine, especially brand names, is ever really a deal. So when he got home, he looked up the drug Vimovo. The drug had been controversial, to say the least. It was created using two readily and cheaply available generic or over-the-counter medications, naproxen, also known by the name of Aleve, and esomeprazole, known as Nexium. So it combines Nexium and naproxen together, and the Aleve handles your pain, and the Nexium helps with the upset stomach that's caused by the pain. But only a minority of people get an upset stomach, so there was no indication I would be one of them. So he said, I did the math. You walk into your local pharmacy and buy a month's supply of Aleve and Nexium for about $40. Vimovo, the pharmacy billed his insurance company, now listen to this, $3,252. That doesn't mean the drug gets paid that much. The pharmaceutical world has a lot of rebates and all that, but that's how much the insurance pays for that drug. Think about it in another way. So you want to eat a peanut butter and jelly sandwich every day for a month, you could buy a big jar of peanut butter and a jar of grape jelly for less than $10. Or you could buy some of that stuff where they combine the peanut butter and grape jelly into the same jar, and it's usually $565 for the jar of goober if you take that formula. So Vimovo is that goober. That's why Americans has been spending so much on it, because the insurance company smartly rejected the pharmacy's claim, but he said, I knew Vimovo's makers weren't wooing doctors like mine for nothing, so I looked up the annual reports of this company. It's in Ireland. It's called Horizon Pharma, which makes Vimovo. And since 2014, Vimovo's net sales have been more than $455 million. That means a lot of insurers are paying way more than they should for that drug. And that wasn't the only drug that Horizon makes. It bought an additional $465 million in net sales from Duexis, which is a similar drug that combines ibuprofen and Pepcid. You know, I don't know why this is legal. I don't know why physicians buy into this. It's a scam. It's just a way to gouge insurance companies or employers' health care plans. Horizon says the high price is justified. The drug maker said it's based on value it brings to the patient. Just because it's a different strength of Aleve, and it's a different strength of Nexium, it can't be substituted. So it's a special formulation that can't have a specific substitution because it's not therapeutically equivalent, although those two drugs themselves in a different form and a different source, which is not very far off, is available just by writing them separately. It uses one of three separate therapies. It's said to the company executed a shrewd strategy to give everyone, insurers, patients, doctors, and pharmacies the incentive to get Vimovo covered. Horizon made deals with insurance payers and pharmacy benefit managers, the intermediaries who help determine the drug's cost. They'd include special rebates, even administrative fees, and Horizon said the drug maker got paid much less than the sticker price, but it was still over $3,000. You know, what they do is they contract pharmacies. This fellow lived in Ohio or someplace. He got his Vimovo from New Jersey, I believe. I have a person on the board of directors with me in this compound, in this community pharmacy co-op that I'm with, that had to get a line of credit for $6 million because it took him so long to get the money back from Horizon. They put boots on the ground, expanding the sales force by hundreds. The company's message to doctors emphasized the convenience of prescribing the two ingredients in a simple pill. The physician had no idea what this medication cost. They also zeroed in on patients' worries about drug costs to encourage them to fill their prescriptions. Horizon covered all but most of their out-of-pocket expenses. That's why the doctor's office could promise him he wouldn't spend more than $10. The strategy worked. He didn't even know why he was getting the prescription, but when they told me it couldn't cost more than I could spend on lunch with a friend, I gave it an okay. I've never heard a pharmacy had never heard of sent me a bottle of Vimovo for $10, even though the insurance company rejected the claim. He didn't get it from his regular pharmacy. He can't get it from his regular pharmacy. They had to go through a particular pharmacy for the patient to receive financial assistance. Horizon wrote the prescriptions for its drugs, might not be filled by certain pharmacies because of insurance company exclusions. So they go outside of the box, and that's what gave them the option of not picking up my pills at the neighborhood pharmacy. Instead, it was mailed to him from the White Oak Pharmacy in New Jersey, which is about 45 minutes away from his house. I drove there to find out why I couldn't get it at my local pharmacy. They said the company sets the price. He insisted that the pharmacy has no special relationship with Horizon, but they do. The drug company steers prescriptions his way because the pharmacy will process the coupons. There is no approved generic, even though you can get the same two drugs, just not exactly in the same space. Their error in giving this patient this drug was that he was a journalist. And he poured through financial filings. It appears that the drug run may be ending for fewer insurance companies have been willing to cover this industry, and this expansion is going getting bigger and bigger. But the people, and I'm worried about the pharmacies that invested in this, because if Horizon goes belly up, they're going to lose millions of dollars, because if they go bankrupt, they're not going to pay these people. By eliminating the cost of barriers in the health system, that's meant to control costs, but the company got patients on board by covering their out-of-pocket costs, and it still rises the price of health care. How can we nullify the consumer check and balance in supply chains? And that's what Horizon did. The scheme that played out with Vimovo is bound to happen again. It's already happening. Drug companies are always on a lookout to deploy similar strategies. This guy took his Vimovo for several days until he noticed it kept him awake in the morning. he has 50 pills left in the bottle, and he said maybe I could sell it back to Horizon for $150. That's not just an exceptional thing. That's happening all over the country. And for insurance companies to be able to charge that kind of money for including two generic ingredients together in a different amount than you can buy them individually for, as far as milligrams of drugs, it's ludicrous. And it should be illegal, it should be immoral, it should be a lot of things. But we're going to go back to why drugs cost you so much and what you can do about it and give you some options. And I was glad to see when I read Consumers, it didn't tell you to go to a different pharmacy. It told you things to do within your pharmacy. But there's another thing. We've talked about opiates for a long time, and you hear about it on the news every day, and the deaths every day, and how it's ravaged the life expectancy among economically stressed white Americans, and now it wasn't doing that, but now it's taking its toll among blacks, Hispanics, and Native Americans. There are alternatives to opiates. We have been very successful with the physicians' help, in reducing people's opiate use, and surprisingly, almost every one of them report feeling better. But there is a drug that they put you on when they're trying to get you off opiates, and that's Suboxone, buprenorphine. And in order to take that drug, a physician has to have, besides a regular DEA number, has to have an X specialty DEA number. And the drug is only approved for opiate addiction, to withdraw you from opiate addiction, not pain management. So in order for them to write you a prescription, and without using that X special number, they have to use it for, if they're going to use it for pain management, they have to write on the prescription for pain management. Now, the drug is not indicated for pain management, and we have people now being withdrawal from opiate that are giving Suboxone by a physician that doesn't have a X number to give them, and we can't fill the prescription without that X number. If they don't put pain management on there, they have to have a X specialty number on that prescription. Now, there are pharmacies in this county that are filling those prescriptions without an X specialty DEA number on it, and it's not listed what that drug is to be used for. If they don't have that special DEA number, they have to write for pain management. If a physician won't do that, then and this drug isn't for pain. This drug is for withdrawal. We've had people on Suboxone from physicians that have an X specialty number for a couple of years. Usually, as well as being addicted to opiates, you're addicted to benzodiazepines, which is Xanax or Ativan or one of those. So we are all for people getting off opiates, and we're all for using Suboxone. But the physician has to have an X specialty DEA number to use it, to write a prescription, and if he or she decides to run it for pain management, it is not fillable by law on a prescription. Otherwise, the liability goes to the pharmacy for filling it without that X number, instead of the physician for not writing that X specialty DEA number on it. So I would suggest, if that's happening to you, you make sure your physician has an X specialty DEA number, or find one that does, in order for you not to be liable for getting that prescription filled, because you're the one that really has, you're the one experiencing the pain. You're the one that's doing the withdrawal, and you're the one that's going through the pain. This epidemic has just expanded dramatically from 1999 to 2010. The data from 2010 to 2015 give a much worse story than 99 to 2010. So everybody is included. The death rate is unbelievable. The fentanyl use and the overdose from fentanyl has skyrocketed, and it's just not a good situation all the way around. So this is a bit of information for a select group of people, and I just want you to know that there aren't any shortcuts here to going through the right way, and the DEA is not tolerant on people who are cutting corners. So, and maybe the physician just forgot to put their X number on the prescription, but if it's not there, it can't be filled, and it is not, if it's for pain management, it can't be filled because that's not an indication for it. It puts the nurse practitioner and the nurses in a bad way for that, but reality is reality and liability is liability, and we have to observe those reasons. We talked to you briefly last week about the Zika virus continuing to spread and that it was down in Long Beach now. And there are things that you can do different maybe than what you'd heard about regular mosquitoes. And I'm going to give you some of those points. And the Zika virus is in California, and there's enough traveling between Southern California and Northern California. You need to know how to deal with it. Some of these examples you've never heard of before. The first one is aim high. When traveling, request a hotel room on the highest floor possible. Mosquitoes aren't strong flyers and prefer to stay in leafy locations such as plants and trees near to the ground. Now, myself as a senior citizen, I'm always asking for a drug on the bottom floor. So don't have to drag luggage down to go to the airport and stuff like this. This is a good reason not to do that unless the hotel or motel doesn't have a elevator. So the second one, drink and pee safely. And what this means is as they, or responsibly, restrooms often contain high numbers of trapped mosquitoes. And if you're enjoying cocktails in the great outdoors, get rid of those empty glasses and bottles as soon as possible because alcohol attracts mosquitoes. So just be careful when you go into these outhouses and that are, I mean, as you travel sometimes, those outhouses are temporary, or if you're going to a function, mosquitoes can be in there, so be very careful. The third one is blow them away. If there are trees or plants near the outside of the windows in your home or office, keep the windows shut, especially at dusk when some species come out in droves for a tasty meal. The type of mosquito, though, that causes Zika bites more frequently during the day, so using a fan or air conditioning will usually discourage any mosquitoes from entering your rooms. Dress light. Keep your black and brown clothes in the closet. Darker shades tend to stand out against the light and are attractive to mosquitoes. So stick to light-covered tops, pants, dresses, especially when spending longer periods of time outside. And number 5, how to spritz yourself. The CDC's recommendation of applying a natural insect repellent made of 30% oil of lemon, eucalyptus, or a synthetic version of that. Remember, those sprays can be dabbed on both in clothes and body. Wear insect repellent, wrist and ankle bands for extra protection. This may seem like it's a little elaborate for the Zika virus. We didn't really expect it to get to California this soon because usually the more tropical areas, and we certainly aren't a tropical area, has a tendency to attract mosquitoes more than a place like California, which is arid in a lot of desert areas. And up here, As you've had experienced, it's 105, 106 degrees last week, and it's going to get up close to 100 again this week. So those are areas that we wouldn't think that these mosquitoes travel to, but all you have to do is go to another area. And if you're of age to get pregnant and you have been bitten by a mosquito that gives you the Zika virus, there's a chance of having a baby that has microencephaly. So you don't want to have that occur if you can avoid it. There's a new guideline for people to manage fibromyalgia, and I know it can be challenging to treat micromyalgia, which causes really widespread chronic pain, often with poor sleep, fatigue, or depression. We have a pretty good way of diagnosing fibromyalgia now. We used to just guess that maybe that's what it was. But there are things that you can do to manage the pain, and not to completely cure the chronic pain. Drug therapy is only moderately effective. As few as 1 in 10 patients benefit if meds are reduced, targeting the most troubling symptoms. Exercise, standing slow and aiming for 20 to 30 minutes, 2 to 3 days a week may feel worse before they feel better, but it's a way to manage that pain. A low dose of the old-fashioned tricyclic antidepressants, and they're used for pain or sleep problems. Amitriptyline, which is the brand name Elavil, but nortriptyline may be better because it's tolerated in more patients. So these are things I don't expect you to remember, but at least maybe you'll remember to, if you're not on these medications, to ask your physician if you're having trouble controlling the symptoms. A selective reuptake inhibitor for a antidepressant, duloxetine or Savella, has the most evidence of work for fibromyalgia. They may help depression, but they aren't useful for other symptoms in many cases. Advise to switch to gabapentin or pregabalin for persistent or poor sleep. That's Lyrica and gabapentin. Gabapentin costs a whole lot less and is just as effective. And gabapentin, for your information, is probably going to go as a control substance. It's already starting in July in Kentucky, and they expect other states to follow. We're not sure of why that's happening. We have some idea. It works. Gabapentin relieves neuropathic pain, and it normally was brought on the market to continue to manage symptoms of epileptic seizures. And it was found out that it was more effective, actually, in the neuropathy associated with those things, and it's used far more now for diabetic neuropathy and total neuropathy than peripheral neuropathy than it is used for to stop seizures. So it is Neurontin is the brand name, and gabapentin is the generic name, and it's not nearly as expensive as it used to be. So adding that to your already list of drugs for fibromyalgia may be very effective in helping to manage that disease. There's also a drug that's a muscle relaxant, cyclobenzaprine, which is Flexeril, that can help for sleep problems as other meds fail. It has a drug structure that's very similar to amitriptyline. And nonsteroidal anti-inflammatories, for some reason, aren't very effective, even though this is an inflammatory disease. Excuse me. They seem to worsen symptoms in some cases. Maybe tramadol works a little more effectively. And if you're using a combination due to possible risk of central nervous system depression or serotonin syndrome, try not to combine tramadol and a SNRI. which is a antidepressant. So fibromyalgia is a very difficult disease, and it's not one that goes away easily. And it usually, in order to manage the fibromyalgia pain, you have to use a combination cocktail of medications to try to keep that pain down. Are there risks? Quality of life is a big risk. And a benefit is a reduction in the pain, so it's not chronic all the time, and it's not a severe chronic pain. So be aware that they're looking at things all the time to treat these diseases like fibromyalgia, and doing everything they can to come up with a symptom to make it simpler. And so the side effects of a lot of those medications keep them away from you, so it's a higher quality of life. We're going to take a break, and when we come back, we're going to talk a little bit more about why drug costs keep rising and what you can do about it. Have you been reading, seeing, and listening to all the concerns about the cost of drugs and the cost of health care since the election in November? Hi, my name is Bill Kearney. My wife Dana, myself, and our employees have been bringing medication and medical supplies to our patients in Lake County for the past 38 years. Our efforts to convince the employers in Lake County that our services here are valuable to people like yourself have been mostly overlooked. As we continue to be a major sponsor of different entities and organizations in Lake County, please remember our support of your organizations. We love Lake County and all of you who have made this such a wonderful place to work and live. So the next time you get a new prescription or refill one of your previous prescriptions, come give us a try. I'm sure you will notice a difference. Getting a prescription from one of our pharmacies just might be one of the best parts of your day. North Lake Medical Pharmacy, with 2 locations, on Hill Road East across from Cedar Lakeside Hospital or outside the Bruno Shop Smart in Lakeport.
This is the Caltrans Road Information Bulletin for Lake and Mendocino County State Highways for the week beginning Friday, June 23rd. In Lake County on Route 20 near Foothill Drive, expect 5-minute delays weekdays, and on Route 175 near Forest Lake Road, expect 15-minute delays. In Mendocino County on Route 1, expect some 5-minute delays north of the Westport North Bridge and south of the Wages Creek Bridge. On 101 from Long Valley Creek to the Empire Camp Rest area, expect 10-minute delays overnight weeknights. Near the Hermitage Vista Point, expect 10-minute delays, and near Piercy, expect up to 20-minute delays. On Route 128 near Philo, a company could cause 5-minute delays weekdays, and west of Yorkville, expect 5-minute delays. On Route 162, expect a few 5-minute delays from Bloody Run Creek to Pukini. On 175 near the Lake County line, expect 30-minute delays. On Route 253 near Singley Cattle Pass, expect 15-minute delays weekdays. And on 271 near Grizzly Creek beginning the 27th, expect 10-minute delays weekdays. That concludes the bulletin. Like us on Facebook for more updates. That's Caltrans District 1.
Jazz on the Lawn, featuring the Swingin' Boonville Big Band, is on July 1st at 1 p.m. at the Mendocino Arts Center on Little Lake Street in Mendocino. Celebrate the 4th of July weekend while enjoying music and dancing to this 19-piece jazz big band. Tsunami Nacho Truck will be serving up their award-winning Asian tuna nachos, among their other fresh menu items. Beer, wine, and soft drinks will also be available.
Raising your family, tending to your animals, growing your own produce, preparing for the seasons, living the country life. Hi, I'm Jody Henke, host of Living the Country Life. Catch me every Monday through Friday at 9:35 a.m. and 4:35 p.m. for ideas and inspiration for your place in the country. That's Living the Country Life here on AM 1270 and 96.5 FM KXBX.
We bring the community closer together, supporting business in every way. We're helping make your dreams come true, working hard for you. Lake County Chamber of Commerce, join today, it pays to belong.
The Lake County Chamber of Commerce would like to recognize the Member of the Month, Orchid Realty. Sam Orchid, broker-owner, has been in business for over 40 years in Napa and Lake Counties, and his expertise will benefit you in buying your next home. For your next real estate transaction, call 486-1646.
Lake County Chamber of Commerce, join today, it pays to belong. Lake County Chamber of Commerce. We're steady and strong, help us shape the future.
All right, Bill, we're back.
We're back, and we're going to be talking about things you can do to relieve some of the expenses. Just to give you a few examples, last year on some insurance plans you could get pravastatin, which was a cholesterol-lowering drug, for $6 for a 3-month supply. Today, under that same insurance policy, it's $49 for a 3-month supply. An estimated 28 million Americans, or 25% of those who regularly take prescription medications, saw a price increase in the past 12 months. Rising costs, drug costs is not a big issue, but the insurance companies are getting higher deductibles. The average deductible, excuse me, to the figures from the Kaiser Foundation is $22.95. For an individual, $43.64. That's $4,364 for a family. I just met my deductible on the Medicare D plan. It was $1,830. About 30% of the people in the United States who have insurance through their employers have health insurance with a high deductible. Then your formulary changes. Insurance companies might stop covering your medication, so you wind up having to pay the entire amount. Last year, for example, Express Scripts, one of the largest PBMs, announced it would stop coverage for more than 85 medications. When Express Scripts does this, which is a PBM that makes more money than any other PBM, when it announced it would no longer cover those medications, it said it was still covering other similar drugs that could be used instead that they make more money on. They can also move a medication from a lower, cheaper tier of coverage to a higher tier. So where you may pay only $10 or $15, you may have to pay $40 or $50 now for an even a percentage of the total price. Some people have to pay 50%. There's a tendency for insurance companies to move your medications to a higher cost tier. That forces you to pay either the higher cost or switch medications. They also make the most of those drug coverages at the start of each year, but they can also change the level of coverage for a drug even after you signed up with their plan. One survey found half of the insurance plans made significant changes to those drugs they covered midway through the year, reducing coverage or dropping the drug altogether. If you're covered by Medicare, your insurer is required to give you a 60-day notice before they make any changes or make any drugs they cover not covered. So one way you might avoid changes is to confirm that your drugs are covered by your insurance company before you sign up, usually in October or November, but that doesn't prevent them from changing that later on. A few extremely high-priced drugs push up costs for everybody. Humira, for example, retail price is about $4,500 a month, or Copaxone, which is $4,500 a month. Then more common medications for high cholesterol or high blood pressure. 72% of drug spending comes from just 10% of brand name medications. Insurance companies pass the high cost on to all consumers in the form of higher monthly premiums. The effect is your monthly premiums might increase, and the amount you pay, even for generic medications, may also be higher. Why don't doctors prescribe less costly meds? Most of the doctors acknowledge the high costs, but they weren't really aware on what the drug costs were. Doctors also reported that they discussed drug costs in a typical week with only about a quarter of their patients, and they did not have enough time to discuss costs otherwise. Unfortunately, many physicians just don't discuss drug prices. Not only do they not discuss costs with patients, they frequently don't steer patients toward cheaper alternatives. Remember, these physicians and nurse practitioners are bombarded by brand-name drug companies coming in and giving them samples. In 2013, the Journal of American Medical Association, Internal Medicine, found that nearly 40% of the doctors said they sometimes often prescribe a pricier brand-name drug at their patient's request. What's causing that? Media advertising. You can't watch television today without every 30 minutes or 15 minutes specific drugs being advertised. Those aren't generic drugs. Those are expensive brand name drugs. And one we've talked about many times, Repatha, which is at least $15,000, is, and you go into the doctor's office on a monthly basis. It's such a problem that the American College of Physicians called for all doctors to prescribe generic medications whenever possible. Now, when we get a physician that prescribes what we call DAW, which means dispense as written, and it's for a brand name drug, we have to dispense that brand name drug. We are automatically audited by an insurance company for giving you a brand name drug. If they don't see a DAW written on that prescription and reminding you, they don't see the prescription when they audit you, when they request an audit. When they audit you, they actually see it. 14% of the people decided not to fill their prescription when they found their out-of-pocket cost increased. That can put people at an obvious risk of not getting essential medications to treat their conditions. And we talked about that last week, about how many people are not taking their medications as prescribed because they can't afford it. Other consumers are speaking up, asking questions, and looking for discounts. 40% of people facing higher drug costs say they ask their doctor or pharmacist for a less expensive drug, or ask their pharmacist for a lower price on the same drug. To show you how many people pay cash, last Monday we filled a considerable amount of prescriptions, 300 and some. 2 customers paid cash. Everything else went through an insurance company or a Medicaid. Customers should ask their physician when they receive a prescription where there might be a generic drug available, and there are things that you can do, strategies that help you rein in your drug costs. Number one, and this was number one on the list, review your drugs with your doctor or pharmacist. Adults who said they currently take a prescription medication, on an average about 5 of them, it sounds like your doctor or pharmacist needs to review all the medications you take and cut out drugs you no longer need. I was talking to my sister who lives in Iowa last evening, and every drug that she was taking, she's 77 years old, is on the do not take for elderly list. The drugs that if you are in a nursing home, they will make you show a reason you have to take, and she's getting blurred vision. Some of those are brand names, some of those are generic. I asked her to send me a list of all the medications she was taking, and I would go through that with her. And you can consider non-drug options for what ails you. For example, for cognitive behavior therapy, for sleep problems, and physical therapy, for exercise, for acupuncture, for treating back pains, or try a cheaper alternative. If there's no non-drug option and no generic risk, ask your doctor about a least expensive therapeutic substitution, which is a different drug that works as well. It may be different chemically, but it's used for the same thing. We see that in muscle relaxants all the time. We see that in some sleep medications. And I know your insurance company doesn't back this, but don't always use your insurance. Ask your pharmacist if you could save by not using your health insurance. Almost all pharmacies, including our Northlake Medical Pharmacies, have a drug plan. There are over 300 generic drugs on that plan, and when we run your prescription through that plan, many times your copay or your pay for a 30-day supply or a 90-day supply is much less than you will pay on your health care plan for the same thing. Now, insurance companies say don't do that. We don't run it through electronically, so there is no way for them to know that you're doing that. They will probably come back and say you're not getting your prescription filled, and that's your opportunity to tell them that you can't afford to get it filled through their insurance plan, but you can go to your local pharmacy, and on their $3.99 and $10.99 plan, you can get a 30 or 90-day supply and save a considerable amount of money. And, you know, sometimes you ask consumers ask you when they aren't using insurance for the lowest possible price. sometimes yield a deeper savings in the thorough use of discount. I had a prescription filled yesterday for a specific drug, and by going through the cash program, not through our discount program or our Good Neighbor Pharmacy program, it came out to $401. I went back to my clerk and I said, "Why didn't you run this through the insurance company?" And she said, "Well, my brain just didn't function. I forgot to do that." And I said, "That's a $300 profit. We would never charge a customer that price that wanted to pay cash." And just by going through there, we saw how difficult it is, and we always check our cash prices. So we always look at, we've had people that switched insurance companies, and they automatically assume that our store, because it's independent, does not cover their insurance. We had that happen yesterday or Monday with a patient of ours, and we called the patient and said, "Is there a reason that you have switched to a different pharmacy?" And she said, "Well, I was told by the insurance company that you were much higher than where I transferred to, and as much as I wanted to keep everything with you, I couldn't afford to pay that much more money." Ended up it was $5 more to stay with us and have the rest of her prescriptions. And as I told you last week, we lost a customer and a patient that we lost $126 on one prescription, and we wanted to tell the patient we couldn't afford to fill that prescription anymore, and she wanted to get all of her drugs filled at one place, and we had to transfer. We lost 5 prescriptions because of that. So there are things that you can do, and you have to become more proactive. I deal with 1,400 stores in my co-op that I'm on the board with, and we're hearing every morning like today about people that are losing money by filling prescriptions. We have one drug plan that is Catamaran that we never make more than $1 when we fill a prescription. It's usually 28 cents, 25 cents, 26 cents, and I know you don't believe that. And if somebody had told me that 2 years ago, that we would be filling prescriptions at that kind of a profit or a loss, almost every workman's comp prescription we lose money on. It's less than what we pay for it. If it wasn't for the rebate programs that we get through our co-ops, we would no longer be in business. So, and talking about that for a second, I get calls all the time saying, I understand you're on new management. Who's the owner now? We're still the owner. We still work. Brandy still runs Hill Road. I and Dana run Bruno's North Lake Medical Pharmacy. Just the manager in Bruno's is not there anymore, so we are managing it ourselves. But we still own both pharmacies, and we have not gone away. It'll be 38 years. Well, it was 38 years in April. So we still have long standing in this community and hope to continue to do that. There is a couple of just small things that came across from one of our sources, and one is about taking baby aspirin to help breast cancer, and it is not, for some reason, a high-dose aspirin or regular dose aspirin is not considered, but low-dose aspirin has reduced the risk of common type of breast cancer. Taking an 81 milligram dose of aspirin appears to be linked to a 20% reduction in the risk of developing HER2 negative breast cancer. That finding comes from an analysis of data from the California Teacher Study that enrolled participants in people who used medications regularly. This group was 1,500 women who developed invasive breast cancer before 2013. They found that the breast cancer was inversely associated with taking 3 or more low-dose aspirin a week. It was not seen with regular dose aspirin or other non-steroidal anti-inflammatory drugs. However, the study does not establish a causal relationship. A 20% reduction is considered a moderate risk in cancer. So anything that will help is certainly worth it. We were going to talk about how you can, different meds make you more sensitive to the sun and heat. I think I'll just go over these briefly. We have enough time to mention them, but not enough in detail. It might surprise you to know that over-the-counter medications such as ibuprofen, fluoroquinolone antibiotics like Cipro and Floxin, even St. John's wort can spoil your summer fun because it can make your skin more sensitive to sunlight, increasing the risk of sunburn, or worse, causing a photosensitivity reaction. I think St. John's wort is one of the worst ones. Painful, itchy rashes, severe blisters. The photosensitivity really comes in two basic forms, phototoxic and photoallergenic. The more common form, UV rays interact with your medication, leading to a rash that looks bad, sunburn within 10 minutes. Less common, though equally bothersome, is photoallergenic reactions, which UV rays trigger chemical changes that causes your body to react as though it's an allergen. This happens with topical NSAIDs such as diclofenac, Pennsaid, Voltaren gel. They may cause reactions more problematic than sunburn and rashes. Sunburn and rashes aren't the only thing that happens. Diuretics, hydrochlorothiazide, Maxide, can make you less thirsty or cause you to urinate more frequently, increasing your risk of dehydration. A friend of mine a year ago who is responsive to a lot of medications having side effects took a very small dose of hydrochlorothiazide, which is a diuretic. He was out in the sun working in a vineyard for about 3 hours, came in the pharmacy with his face bright red like he'd been burned by a welder's torch or something, and it was very surprising to see, and that's what it was. Other common drugs such as this amitriptyline that we talked about, Elavil, oxybutynin, which is for bladder infection or bladder to regulate the bladder overactively. All of those effects raise your heat-related illness. The best way to protect yourself is know your meds. Drug side effects from heat and sun are often overlooked. Hydrate. I think I related to you a couple of weeks ago. I was out in the sun, I think on Father's Day or Memorial Day weekend, and I lost 8 pounds out there. And when I got back in my home, I weighed myself, and I thought, gee, you haven't weighed this less in a long time. So if you take a look and see, and I was dehydrated. And I knew when I was out there, and I thought I was drinking enough fluid, but evidently I was losing a lot more than I was taking in. Use sunscreen daily, reapply often, you know that. Stay in the shade or avoid being outdoors in the early afternoon. Stay cool, do outdoor activities in the morning and evening, and meds that might increase sun sensitivity, over-the-counter medications like Clearasil, Retin-A, which you're always told to stay out of the sun, antibiotics such as Cipro or doxycycline, antidepressants such as amitriptyline or Sinequin, high blood pressure drugs, ACE inhibitors like Lotensin, which is benazepril, or captopril, angiotensin II such as Diovan, and thiazide diuretics such as chlorothiazide, hydrodiuril, pain medications, ibuprofen, naproxen, diclofenac, antidepressants. We talked about antihistamines such as Benadryl, antipsychotic drugs, which are really bad for this, Zyprexa and Risperidol, high blood pressure drugs we talked about, overactive bladder, Vesicare, Oxytrol. These are all things that, again, we didn't have time to delve into within depth, but if any of those drugs sound like something that you're taking, or if you have any questions about photosensitivity on the medications you're taking, call us at the pharmacy, 263-1328 at Bruno's, or 263-6192 on Hill Road. 263-1328 at Bruno's, 263-6192 on Hill Road. The last thing we're not going to have talk about in depth was diet sodas. And the main thing I want to bring up without going into detail is there's been an awful lot of publicity, especially on the internet, about drinking diet sodas and how it's going to cut your life, your annual or your mortality rate, where you can get more heart attacks and strokes from drinking these beverages, and they assume that it's related to aspartame or the sweetener. Keep in mind that there are other diet drinks on the market that aren't diet sodas that people take that have similar links as far as stroke or heart attack or type 2 diabetes. And the studies have several limitations that don't prove that diet sodas themselves cause people to have strokes. It could be that people who drink diet sodas are in poor health to start with, people who don't, for instance, but findings do jibe with some of the research. They also found links between diet sodas and depression, but they would have to drink 4 or more cans of diet sodas each, and they said they were 30% likely to be diagnosed with a form of depression. So it is a wide study. Sugary drinks had a higher risk of heart disease than those who drank diet sodas. Another reason that scientists hesitate to say definitely that they're bad for your health is they aren't sure how they increase the risk. Some evidence suggests that the artificial sweeteners in diet sodas can cause inflammation, which is often associated with heart disease. It's also possible that artificial sweeteners trick the brain into craving rich, high-calorie foods, leading to weight gain. I will tell you something, that as I was a drinker of Diet Pepsi, to keep me going for 12 to 18 hours 3 or 4 years ago, and had been for several years. By the time I got home, I was running out of steam. At noontime, I was running out of steam. At 3 o'clock, I was running out of steam. Getting up at 4:30 in the morning and going for 12 hours is a tax on most people's body. So I was drinking 4 to 5 of those a day for a few years. And I found out that after I drank one of those, and I'm not a sweet eater, I don't normally care for sweets, even chocolates. Once in a while, I like chocolates with caramel or nuts in them, and I would have a craving for a candy bar after I drank one of those, which could have led to a weight gain. So now I have to tell you it's time to go and wish you a happy 4th of July. North Lake Medical Pharmacy is with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Give us a call at 263-6192 or outside the Bruno Shop Smart. Give us a call there on 347 Lakeport Boulevard at 263-1328. Happy 4th, Paul.
Happy 4th of July to you too, Bill, and we'll see everybody back here again next Wednesday after the 4th of July for Health Talk on AM 1270 and 96.5 FM, KXPX Lakeport.